it should be your everyday work and something that you're very familiar with. So it shouldn't be, once again, something that throws you off guard, and you'll just go back to first principles of triaging. And if you need to ask for more information, you should be very happy to do so and say what you need to make those extra decisions, and ask for more clinical staff.
The topics in this video are clinical scenarios, Part 2 continued, ethical scenarios, interview scores, Part 1.
It will be potentially a triaging clinical scenarios that you're used to working with. So it should be your everyday work and something that you're very familiar with. So it shouldn't be, once again, something that throws you off guard, and you'll just go back to first principles of triaging. And if you need to ask for more information, you should be very happy to do so and say what you need to make those extra decisions, and ask for more clinical staff. It's about safety generally, and I think that I'll see if you have anything to add about that, because I think that's my experience of these types of clinical scenarios within interviews.
I think the other thing you have to bear in mind is sometimes the clinical scenario is there but slightly disguised in the sense that they don't actually give you the scenario, but they will ask you to describe a case that either went very well and why you think it went well, so you're being asked to reflect on that, or a case that didn't go so well, or perhaps at a more senior level they might ask you about breaking bad news. So it's always worthwhile sort of thinking about, in your experience, have you got any examples to demonstrate these sort of qualities that, yes, you did need to call on the full multidisciplinary team because you needed medical or surgical or anaesthetic support or blood bank involvement if we're talking about a bleeding scenario, and senior nursing staff, and sort of, so don't just expect something that is, how do you manage case X? You might need to do something that's you've managed yourself and come up with that case. And be careful if they ask you a second case type safety one later, you have a second case available as well that you can sort of modify into those questions. But the sort of thing that you think, oh, I'll be able to think of that off the top of my head, but when you're faced in the interview situation, you're not thinking of what you did last week, even though you may have been really successful and been, you know, really good. So sometimes it will be a, how do you manage this scenario? Sometimes it will be, tell us a case that you've managed well, or a communication with a patient or family, etc. So think of those ahead and prepare those.
I think that's where the STAR format comes in really well, because it's that situation, the task, the action, and the result. Using that format can help really structure it so that if you do go a bit blank, it will help you think through something that's happened, and you can help develop that case as you go along. So, and I think it's really important what Caroline was saying, that it's really important to add in communication, because that's really, really important within NHS interviews, that the communication aspect of these cases is really focused upon, because if a situation hasn't gone well, that we make sure that we've managed the communication well and the governance aspects of all of these cases well as well.
So make it clear that you've managed the case and what you've done, and if you've needed to ask for help, that you've recognised that need and you're asking for help, and so that the interviewers know that you've done all that and you've been able to manage it yourself and recognise your own limitations, because as we said at the start, it is all about safety and the safe management of the patients. And just finally on that, nobody knows what you've ever done. So if you start trying to describe a scenario and then think, oh, I can't remember what happens next, it doesn't matter. If you've started on a bleed, just make it up as you go along, using your basic principles, because nobody's ever going to look back at your logbook to say, well, actually, no, you called A at that point, not B. And as long as you've got it all in, don't think it has to be exactly word for word to what happened, because we don't know. But as long as we know you're safe and you recognise the issues, that's the key thing.
Right, so I think that was massively useful. I think the key takeaway is that we prepare for emergency scenarios while thinking about safety decision making and communication. Right, so my next question would be about ethical scenarios. Can you tell us what are the key things to think about while facing ethical scenarios or questions?
I think so. In ethical scenarios, again, I think the most important thing they want you to understand is the patient safety. So in any scenario, when you want to make a decision, it should always revolve around the patient safety, because I think patient safety is a key thing in NHS. In fact, I told in one of my interviews that the NHS is like our solar system, where the patient is the center of the universe, and then we are all revolving around the patient, and everyone laughed. But it is true, patient safety is the most important thing. So whatever ethical scenario you are faced with, primarily what they want to do is that they want to find out that you give importance to the patient. So you consider the patient is the most important, and you don't have a cavalier approach. I'll just give it a go. So they don't like the cavalier approach, and nobody wants you to have a cavalier approach. So they want you to be safe and give that most importance to the patient. I do remember that in one of my interviews I was asked. So they did ask me about the scenario where there was a new procedure, which was an experimental procedure, which costed a lot of money. Only one of my colleagues was doing the procedure, and so they said that the colleague is suddenly fallen off sick, and you need to do this procedure. Would you be happy? You are called for short notice and asking you to do the procedure. I said no, I wouldn't do the procedure. They said, but it costs the hospital a lot of money. Don't you think it is unwise to waste so much of money? But I don't think it is a good practice, because if you're not in a procedure, then irrespective of the money or the constraints, you still shouldn't be doing the procedure, because you are doing harm to the patient. So whatever scenario they put in, with ethics or whatever it is, I think patient safety is the most paramount, and you have to play to that. So making sure that you put patient safety at the heart of everything. That's my only answer I can have. Think about ethical scenario. I'll pass it on to Clare.
I think linking on with that is that you have to think about your own safety and your own expertise, and if you don't feel confident in dealing with that scenario, it's far best to be honest either with the patient or with whoever's trying to pressurise you into that scenario, if we're talking about that sort of scenario, to actually say, no, I don't think it's in the patient's best interests, there's far too many risks, and we will just have, in that scenario, just have to cancel the patient and then relist or refer on to somebody who has got that expertise. A lot of the ethical questions won't have a clear yes or no answer to them, and so some of the things they're looking for is that you can actually just sort of reason through the problem to actually come up with a safe alternative that the patient is happy with, and obviously first do no harm.
And I think a lot of it will come down to things about big questions which may surround patients' capacity, patients' autonomy, patients' best interests, and these are big areas that you'll need to read about, and not doing any harm, providing justice, making sure that there's equity of care for patients, following guidelines, following your own principles of patient safety, following good governance procedures, and ethical principles in terms of making sure that you're observing good practice within the department, reporting clinical incidents. These will all be ethical considerations that you may get asked about and you'll need to read about in preparation for the interview. So I think it's quite a large area that will take up some preparation for interviews, and I think it's one of the areas that candidates do worry about in interview preparation. But I think there's quite a lot of information out there, so it's quite a big area to cover in terms of interview preparation, but I think it can be prepared for. But I think there's a lot of ethical situations that we're facing every day as doctors, and I think it's doing your reflections on them as we're going along that will help you prepare. And I think, as Caroline said before, not leaving it to chance when we're thinking about ethical situations that we've met as well, because it could be one of those open-ended questions that we get asked. Rather than getting given an ethical dilemma, what would you do? It could be said, what is a recent ethical dilemma that you faced and how did you deal with it? So having maybe some in the bank for yourself to think, well, what was a recent ethical dilemma and how did I deal with it, so that you can present that to the panel to say how you successfully dealt with an ethical dilemma within your own practice. Maybe something useful for you to come up with for the panel.
So adding on that, sometimes there is no yes or, it's not like a straightforward question, and sometimes most of us will not know the right answer. So at that point you can always say that you will always refer to the local hospital guidelines, got the NICE guidelines, and sometimes difficult questions you might have to go to MDU, which is the Medical Defence Union, or even you have to go to the GMC guidelines. So say that I won't hesitate to refer to these guidelines to find the appropriate answer and involve the patient in decision making. Sometimes like experimental procedures, you need to speak to the patients and you need to involve them, informed consent so that the patients get involved in that. And sometimes it's difficult. For example, in UK you have got patients who are Jehovah's Witness, who are quite strict against giving blood to them. And there has been scenarios where where there was a life-threatening emergency where we didn't know whether we had to give the blood or not because there were some caveats were there, and we had to actually refer to the Medical Defence Union. So we actually rang up the Medical Defence Union regarding that situation, and they gave us the right guidance like how to deal with the situation. So sometimes there is no yes or no answer. So you might have to refer it to the you might have to refer it to various unions or GMC itself to find the right answer, because we are not all experts and we don't deal with the intricacies of the scenarios. Straightforward scenarios are fine, where you can say yes or no, but there might be a lot of intricacies in this. So basically, the reason they are testing you is that whether you understand that you are not competent to make the decision and you are happy to escalate it. So because not all of us know everything, so there are instances where we will not be knowing the right answer, where you're happy to even consult a colleague for that, or escalate it to the various unions and organizations to get the right answer. So that's what they might be checking in the ethical scenarios. And as long as you are able to provide that, you will not hesitate to contact these unions, organizations to get the right answer. That proves that again you are a safe doctor and you don't leave anything to chance.
The other thing is some of the hospitals in the UK have an ethics committee. So if you've got something that doesn't need an immediate answer, then it's always worth asking and seeing if the hospital has an ethics committee and whether they would be able to help you with that, that decision. So again, it's aware that there are other people around who can help, and it may not be you that has to actually make that ethical decision. Just know where to ask for help.
And at the level that we're talking about these interviews, once again, it's escalation to the senior members of the team who then would probably take on these roles for you, and it would then be a learning experience to find out about what the channels would be. As my colleagues have said, every hospital trust in the UK has a legal team, has a safeguarding team that can help with some of the more difficult ethical issues that we have to face if they're not immediately needing to be dealt with, if they're not acute situations. And even in acute situations, there's always somebody on the end of a phone line, if not immediately present, to help you deal with these situations.
Okay, so I believe that we have covered the most important aspects of interview preparation and the most common questions that I get asked a lot. So now we are curious to know, how is an interview scored, and like, do you follow any criteria?
Yes, all interviews are scored. Each panel member will have the same score sheet in front of them, and the actual scoring will depend very much on what the trust has decided the scoring. It might be as simple as 0 means that they've not answered the question properly at all, so there's no evidence provided in terms of what they've been asked. It might be 1 that there's some evidence, and it might be 2 that there's abundance evidence, and therefore you're confident that they've answered the question well. As I said, each unit will score differently, but all of them will be looking at things like the clinical side, so the knowledge, the skills, the performance that's demonstrated for that post. There will be a lot on safety and quality, and that's where you can bring in any projects that have led to change. And again, if you haven't got anything clinical, but you've done some work outside medicine, mention that when you get a chance to have a safety or quality question. Audits would come under that. And they want to see that you are, flexible, that you will adapt, you will learn, and that you will be a safe pair of hands. And you want to teach. So at some point in your interview, you need to get over the fact that you've got some teaching experience, because that will almost certainly score you some points. The other things that will be scored on will be things like communication, partnership, team working, and those are the things that you need to pull out in your clinical scenarios, in your additional information that you're doing, and we're not expecting candidates to do absolutely everything. We want to know that everybody, even at consultant interviews, that they will recognise their own limitations, and will ask for help. And your extracurricular activities sort of come in that. And you're keen. We want to know that you're keen to actually take the job and work. And then the other thing, which is partly what the ethical question will help with, is that it's a maintaining trust, so that it's you displaying honesty, integrity, you're aware of these dilemmas, but you also understand patient confidentiality, and that that is the case, because there's you've obviously got to think of GDPR and things like that, and bearing all that in mind, and not just going and talking about a patient to somebody in the corridor. So all of those are scored. All the scores from each panel member will be added up. There is usually a cut-off score, so that if you don't make that cut-off score, you're not discussed any further. And then depending on the number of posts and how people are scored, there is then some discussion. So the scores don't mean everything, but they are the main sort of decision making as to who makes that cut off and who doesn't. And that's why in your feedback you might find that you're told another candidate scored better than you, or you scored best out of all the candidates, because we've taken it on a number basis.
So on that to add, and most of the interviews I had been part of, so the scoring system is 0, 1, 2, 3. So 0 is poor, 1 is average, 2 is good, and 3 is excellent. So it's a very subtle difference between average and good. Sometimes when you answer, you have got the knowledge, but the way you come across, people might put you as average rather than good. So when you're answering, please be more enthusiastic about the answer, and your body language is very, very important. Because I had this candidate recently who was answering, he had the knowledge. In fact, his answers were really good, but I felt like he has been pulled to attend the interview, because he wasn't that keen to give the interview. That was the impression I had in that interview. So basically, he gave the correct answers, but in a casual manner. he wasn't showing any interest, and I had to score him 2 instead of 3. Whereas actually, based on his knowledge, I should have given him 3, but I scored him 2. So when you answer, please show the the enthusiasm, the liveliness. That matters a lot. If somebody is giving an average answer but he's very lively and enthusiastic, we think that he's up for it, and then we might give a 3. So it's a subtle difference. So please, when you give your answers, be more lively and more enthusiastic. Have some presence of mind, and look at the body language of the interviewer as well, and then sort of get in line with that, be in the same wavelength. And then when you answer, that will interest the interviewer. And so, who wants to score a 2 for you might give you a 3. These all matters. The score matters. So please, thank you.
Yeah, it's really just to add to that, and I think you can hear the way that Caroline has described. It's the way that the scores are calculated, and the scoring system is taken directly from the GMC standards. So don't forget to look at them. They're very much leaning on the GMC standards that are used across for the interview panel. So if you look at, they're freely available. So I'm not saying that all interview score sheets will be like that, but if we think about all of the UK curriculums, they're all aligned. All of them